How to prevent and treat sinusitis in the elderly. Sinusitis is one of the common diseases in the elderly, causing many difficulties in daily life, affecting the health and quality of life of the patient. Sinusitis is not simply headaches or stuffy nose, but can also lead to serious complications if not detected and treated promptly. In particular, in the elderly, the immune system is weakened and chronic diseases often accompany, increasing the risk of sinusitis and making the disease more complicated. In this article, we will learn about methods of preventing and treating sinusitis for the elderly. Along with that is advice from medical specialists, helping the elderly to protect their health effectively. What is sinusitis? Sinusitis is an inflammation of the sinuses, which are hollow cavities in the bones of the face and head that help filter, humidify, and warm the air that enters the lungs. When these sinuses become inflamed, they swell and become blocked, hindering ventilation and leading to unpleasant symptoms such as nasal congestion, runny nose, headaches, facial pain, and a feeling of fullness in the structure and function of the sinuses. The facial sinuses are small cavities located in the bones around the nose and eyes. These sinuses include frontal sinus located above the eyes on the forehead, sinuses located deep inside the nose on either side of the nose, maxillary sinus located in the cheek area, sphenoid sinus located deep in the skull behind the eyes. These sinuses normally contain air and are lined with a mucous membrane that secretes fluid to help clean and protect the nose from bacteria, viruses, and allergens. However, when the lining of the sinuses becomes inflamed, it increases mucus production and causes the sinus cavities to become blocked, creating favorable conditions for bacteria or viruses to grow and cause disease. Sinusitis can be divided into two main types. Acute sinusitis usually lasts a few days to a week and results from a viral, bacterial, or fungal infection. Chronic sinusitis lasts 12 weeks or more, has long-term effects on the patient's health and requires more intensive treatment intervention. In the elderly, sinusitis can easily be overlooked or not treated promptly because the symptoms may be milder or confused with other health problems. In addition, the elderly's weakened immune system and underlying medical conditions such as heart disease, high blood pressure, or diabetes can increase the risk of sinusitis and make treatment more complicated. Causes of sinusitis in the elderly. Sinusitis is a common disease at all ages, but the elderly are more susceptible to this disease. As the body ages, many changes in the immune system and body structure occur, creating favorable conditions for sinusitis to develop. Understanding the causes of sinusitis in the elderly helps doctors and patients to be proactive in preventing and treating the disease effectively. 1. Weakened immune system. One of the main causes of sinusitis in the elderly is the decline in the body's natural immune function. As we age, the immune system becomes weaker, and its ability to fight pathogens such as bacteria, viruses, and fungi decreases. This makes the body more susceptible to infections, including sinus infections, leading to sinusitis. In addition, a weak immune system also reduces the body's ability to repair tissues and cells, prolonging the duration of inflammation and causing chronic symptoms. 2. Changes in respiratory tract structure. As people age, the structure of respiratory organs such as the nose and sinuses also changes. The mucous membranes in the sinuses become thinner and more vulnerable. At the same time, the mucus glands in the nose and sinuses produce less, making the mucosa dry and reducing its ability to clean itself, creating favorable conditions for bacteria and viruses to invade. In addition, the degeneration of the respiratory organs, especially chronic diseases such as allergic rhinitis or nasal obstruction, also increases the risk of sinusitis in the elderly. 3. Allergies and chronic rhinitis. Allergies are a common cause of sinusitis in people of all ages, but in older adults, nasal allergies can become a trigger for sinusitis. Older adults are more susceptible to allergies to agents such as pollen, dust, animal hair, or mold. When exposed to these factors, the immune system reacts strongly and causes rhinitis. Prolonged allergic rhinitis can lead to sinusitis, especially when nasal mucus is not cleared promptly, causing congestion in the sinuses. In addition, chronic rhinitis, a condition of prolonged and recurring rhinitis, can easily turn into sinusitis if not treated properly. 4. Underlying diseases in the elderly. Many common underlying medical conditions such as diabetes, cardiovascular disease, high blood pressure, or lung disease can increase the risk of sinusitis. These conditions reduce the body's resistance and cause changes in blood circulation and airflow in the body, especially in the nose and sinuses. For example, diabetics may experience infections more easily due to a weakened immune system, creating conditions for bacteria to grow in the sinuses. 5. Effects of drugs and medical treatments. Long-term use of medications, especially pain relievers, antibiotics, heart medications, or anti-inflammatory drugs, can cause side effects that increase the risk of sinusitis in the elderly. Some medications can reduce the ability of the body's mucus glands to function, leading to dryness of the nose and sinuses. This makes it difficult for the body to clean itself and clear out infections, creating favorable conditions for bacteria and viruses to enter the sinuses. 6. Environmental pollution and environmental factors. Air pollution and environmental allergens are a major contributor to sinusitis, especially in older adults with weakened immune systems. Smoke, chemicals, and other air pollutants increase the risk of sinusitis, causing congestion and damage to the lining of the nose. These factors can increase the level of inflammation in the sinuses and cause the condition to become chronic if not treated promptly. 7. Unhealthy diet. A poor or inadequate diet can also affect the health of the immune system, increasing the risk of sinusitis in the elderly. A diet lacking in vitamin C, vitamin A, zinc, and other important minerals can weaken the body's ability to fight infection. Additionally, eating a diet high in processed foods, lacking in fiber, and foods rich in omega-3s can also increase the risk of sinusitis. 8. Smoking habits and exposure to cigarette smoke. Smoking and exposure to secondhand smoke are major causes of sinusitis in older adults. Cigarette smoke damages the lining of the nose and sinuses, and impairs the sinus's natural ability to clear them. This makes it easier for bacteria and viruses to enter and cause infection. Even if older adults do not directly smoke, exposure to secondhand smoke can cause similar damage and increase the risk of developing the disease. 9. Physical weakness due to aging. Aging is an inevitable factor that has a profound impact on the health of the respiratory system, including the nose and sinuses. As the body ages, the organs in the body no longer function as efficiently as they once did, making it more difficult to detect and treat health problems. Aging can also reduce the body's ability to heal itself, making conditions such as sinusitis more persistent and difficult to treat. Conclusion: sinusitis in the elderly is a complex disease and can originate from many different causes. Early identification of the causes of the disease and appropriate preventive measures are very important in minimizing risks and improving the quality of life for the elderly. Symptoms of sinusitis in the elderly. Sinusitis is a common disease in all ages, but for the elderly, the disease can develop silently and last for a long time, greatly affecting health and quality of life. Identifying the symptoms of sinusitis in the elderly is very important for early detection and timely treatment. Symptoms of sinusitis in the elderly can be different from other ages and are often unclear at first, leading to late diagnosis and difficulty in treatment. 1. Pain and pressure in the facial area. One of the typical symptoms of sinusitis is a feeling of pain and pressure in the areas around the face, especially the nose, forehead, and eyes. However, older people may not feel as severe pain as younger people, and often only feel mild discomfort. Pain may occur on one or both sides of the face, with a feeling of heaviness in the nose, or the area between the eyes and forehead. This feeling may increase when the patient bends down or tilts the head, affecting daily activities. 2. Nasal congestion or runny nose. Nasal congestion is a common symptom of sinusitis. However, in older adults, this symptom may not be as pronounced and often only causes difficulty breathing through the nose, especially in the morning when waking up. The nose may be blocked or have thick mucus, especially when the sinuses are severely inflamed. Nasal discharge may be constant or may completely block the sinuses, reducing the ability to breathe through the nose. Older adults may also have difficulty breathing while sleeping, leading to snoring and lack of sleep. 3. Cough and sore throat. Coughing is a fairly common symptom of sinusitis, but in older people, this symptom can last longer and is easily confused with other respiratory problems. Coughing can occur due to mucus from the sinuses draining down the throat, causing irritation and leading to a dry or productive cough. In particular, the cough can last throughout the day and become worse at night, disrupting the patient's sleep. In addition, older people with sinusitis may also feel a sore or itchy throat due to mucus being clogged in the sinuses and tending to drain down the throat. This feeling can make the patient feel dry throat, difficulty swallowing, or have a feeling of something stuck in the throat. 4. Fatigue and low energy. Fatigue is a common symptom in older adults with sinusitis. When the sinuses are inflamed, the body is faced with a prolonged infection or inflammation, causing the body to expend a lot of energy to fight the disease. This leads to a state of chronic fatigue, reducing the ability to work and participate in daily activities. Patients may feel exhausted even when doing light work, and this can greatly affect their quality of life. 5. Loss of smell and taste. A less noticeable but important symptom of sinusitis in the elderly is loss of smell and taste. When the sinuses are inflamed, the organs that sense smell and taste can be affected, reducing the patient's ability to smell or taste. This symptom can make the elderly feel that eating is not enjoyable, even causing long-term loss of appetite. 6. Mild fever and chills. Although fever is not a typical symptom of sinusitis, in older adults, sinusitis can cause a low-grade fever accompanied by chills. Fever usually occurs only when sinusitis is caused by bacteria or fungus, and can last for several days. The patient may feel hot and sweaty, along with a feeling of fatigue. 7. Headache and dizziness. Dizziness and headaches are common symptoms of sinusitis. Older adults may experience severe headaches, especially in the forehead, or notice changes in the frequency or intensity of the headaches. The headaches may be persistent and may spread to the neck or face. Dizziness may also occur when standing up or changing positions, as the blockage in the sinuses reduces blood flow and oxygen to the brain. 8. Difficulty sleeping and snoring. When sinusitis causes nasal congestion and mucus to not drain, older adults often have difficulty breathing while sleeping. This can cause snoring or temporary cessation of breathing while sleeping, a condition called sleep apnea. Snoring or difficulty breathing prevents a person from getting a good night's sleep, which can lead to fatigue and a reduced quality of life. Symptoms of sinusitis in the elderly can vary and are not always easy to recognize. Therefore, if the elderly experience symptoms such as facial pain, nasal congestion, cough, fatigue, or difficulty breathing, they should see a doctor for timely diagnosis and treatment. Early detection and effective treatment will help minimize complications and improve the patient's quality of life. Preventing sinusitis in the elderly. Sinusitis is a common condition, especially in the elderly, when the immune system is weakened and the body is susceptible to infection. However, sinusitis can be prevented with proper healthcare measures. Below are effective methods of preventing sinusitis for the elderly. 1. Maintain nasal and sinus hygiene. Cleaning the nose and sinuses is one of the most important ways to prevent sinusitis. Older adults should maintain a regular habit of rinsing their nose with a saline solution, or using a neti pot to clear mucus and dirt from the nose. Rinsing the nose helps clear the nose, reduce congestion, and prevent bacteria from growing in the sinuses. In addition, when the weather changes or when there are signs of a cold, the elderly should use a humidifier to keep the air in the room moist, especially on winter days or when using air conditioning. This helps prevent nasal dryness, a factor that increases the risk of sinusitis. 2. Avoid contact with allergens. Allergies are one of the leading causes of sinusitis, especially in the elderly when the immune system is no longer as strong as before. Allergens such as pollen, dust, mold, and animal hair can irritate the lining of the nose and sinuses, increasing the risk of sinusitis. To prevent allergic sinusitis, seniors should avoid exposure to allergens. If they live in an environment with a lot of pollen or dust, they should keep their windows closed and use an air purifier to reduce dust and pollen. In particular, they should also clean their homes, change bedding regularly, and shower after contact with animals or going outside. 3. Limit exposure to cigarette smoke and pollutants. Cigarette smoke and air pollution are two major risk factors for nasal and sinus health, especially for older adults. Cigarette smoke not only damages the lining of the nose, but also causes chronic inflammation in the sinuses. Older adults should avoid exposure to cigarette smoke and limit going outside on days with high air pollution indexes. In addition, if they live in an environment where people smoke, they should be asked not to smoke indoors and to keep windows and doors open when necessary. 4. Timely treatment of related diseases. Elderly people often suffer from some diseases such as allergic rhinitis, chronic pharyngitis, tonsillitis, or other respiratory diseases. These diseases, if not treated promptly, can be the cause of sinusitis. Therefore, when there are signs of these diseases, the elderly should see a doctor for early diagnosis and treatment. Timely treatment helps prevent the disease from getting worse, avoiding sinusitis from becoming a chronic problem. 5. Boost the immune system. A weakened immune system is one of the factors that increase the risk of sinusitis in the elderly. To prevent the disease, the elderly need to maintain a healthy diet and supplement the body with essential nutrients. Foods rich in vitamin C, vitamin E, zinc, and antioxidants will help strengthen the body's resistance, helping to prevent inflammatory diseases, including sinusitis. In addition to diet, regular exercise is also important to maintain a healthy immune system. Seniors can participate in light activities such as walking, yoga, or swimming to maintain physical fitness and overall health. 6. Be careful when changing temperature. Sudden changes in temperature from hot to cold or vice versa can irritate the nasal mucosa and increase the risk of sinusitis. Elderly people should avoid rapid temperature changes, especially when going outside in cold weather or entering air-conditioned rooms. When going out in winter, they should wear a mask or scarf to keep their nose and face warm, helping to reduce the impact of cold air on the nose and sinuses. 7. Maintain oral and ear, nose and throat hygiene. An important factor in preventing sinusitis is maintaining good oral hygiene and ear, nose and throat hygiene. Sinusitis can arise from dental disease or sore throat if not properly cared for. Seniors should pay attention to brushing their teeth at least twice a day, using mouthwash, and visiting the dentist regularly for oral health checkups. In addition, they also need to keep their ears, nose, and throat clean regularly to avoid infections, especially in environments with many bacteria or viruses. 8. Use medication as prescribed by your doctor. If an older person has a history of sinusitis or related conditions, preventive medication may be an effective solution. However, medication must be used as directed by a doctor. Medications such as nasal sprays, antihistamines, or anti-inflammatory drugs may be prescribed by a doctor to help control symptoms and prevent recurrence. Sinusitis is a preventable disease, especially for the elderly. By maintaining good nasal and sinus hygiene, avoiding exposure to allergens, controlling underlying medical conditions, and improving resistance, the elderly can reduce the risk of sinusitis. However, when symptoms of the disease appear, it is important to consult a doctor for timely treatment to avoid serious complications. Sinusitis is a common condition in the elderly, and timely and proper treatment is important to relieve symptoms, prevent complications, and improve quality of life. However, treating sinusitis in the elderly requires caution, as their bodies may be more sensitive to medications and treatments. Here are some effective sinusitis treatments for the elderly. 1. Medical treatment. Medical treatment is the most common method of treating sinusitis, helping to reduce symptoms of inflammation, congestion, and pain in the sinus area. Some of the drugs used to treat sinusitis in the elderly include painkillers and fever reducers. Painkillers such as paracetamol or ibuprofen help relieve pain and reduce fever, which is important because sinusitis is often accompanied by symptoms such as headache, facial pain, and low-grade fever. However, the elderly should be careful when using these painkillers, especially ibuprofen, because it can be harmful to the body. B. Nasal sprays. Nasal sprays help clear nasal passages and relieve congestion. Nasal sprays containing corticosteroids such as fluticasone or budesonide can reduce inflammation and swelling in the nose and sinuses. However, nasal sprays can cause side effects if used. C. Antihistamines. Antihistamines may be used if sinusitis is caused by allergies or a virus. They help relieve symptoms such as itching, runny nose, and congestion. However, antihistamines can cause drowsiness, so older adults should be cautious when using them, especially when driving or operating machinery. D. Antibiotics. In case of sinusitis caused by bacterial infection, the doctor may prescribe antibiotics. However, the elderly are more susceptible to side effects of antibiotics, especially those that reduce kidney function. Therefore, the doctor will have to choose the appropriate antibiotic and closely monitor the treatment process. E. Expectorants and decongestants. Certain medications such as expectorants or decongestants may be used to thin the mucus in the sinuses and relieve congestion. These medications may be prescribed for older adults with chronic sinusitis or persistent nasal discharge. 2. Surgical treatment in cases of chronic sinusitis or severe sinusitis that does not respond to medication. Surgery may be a last resort. Sinus surgery can help open blocked sinuses, remove inflamed tissue, or drain pus from the sinuses. Endoscopic sinus surgery. This is a common and minimally invasive surgical method. The doctor uses an endoscope with a camera attached to see inside the sinuses and perform the surgery. B. Sinusectomy. If sinusitis is severe or other treatments are not effective, sinusectomy may be considered. This surgery is usually only indicated when other treatments are unsuccessful and serious complications of sinusitis have occurred. Sinusectomy removes infected or inflamed tissue, helping to improve the patient's health. However, recovery from surgery can be lengthy, and elderly people need careful postoperative care. 3. Natural treatment. In addition to medication, there are a number of natural and supportive approaches that can help relieve symptoms and treat sinusitis, especially for older adults. Use saline to wash your nose. Washing your nose with saline solution is a simple but very effective method to clean your sinuses and help reduce sinusitis symptoms. Elderly people can use saline solution to wash their nose daily, helping to remove dirt and bacteria, while reducing inflammation in the sinuses. B. Steam inhalation. Steam inhalation using essential oils such as eucalyptus, lavender or peppermint can help loosen mucus, reduce congestion and soothe sinusitis symptoms. Elderly people can perform steam inhalation in a closed space to help relieve nasal congestion and sinus pain. However, care should be taken when using steam to avoid burns or inhaling hot steam for too long. C. Healthy diet. A balanced and healthy diet plays an important role in minimizing sinusitis. Elderly people should supplement foods rich in vitamin C, vitamin E and minerals such as zinc, which help strengthen resistance and reduce inflammation. Foods such as green vegetables, fruits, seafood, and foods rich in fiber will help support the health of the sinuses and respiratory system. D. Drink plenty of water. Drinking enough water helps keep the body moist and reduces dry nose, one of the causes of sinusitis. Elderly people should maintain a daily water intake of 1.5 to 2 liters of water to support the respiratory system and reduce congestion in the sinuses. 4. Regular treatment and health monitoring. For the elderly, sinusitis treatment is not simply about using medication but also requires regular health monitoring. Re-examination and checking the condition of sinusitis after a period of treatment helps to detect problems early and adjust the appropriate treatment method. Older adults should be encouraged to maintain regular follow-up appointments with an ENT specialist to monitor their condition and adjust their treatment plan as needed. The doctor will evaluate the sinusitis condition, recommend alternative or complementary treatments as needed, and help the patient improve their health and prevent sinusitis from recurring. Treating sinusitis in the elderly is a long-term process and requires patience. Treatment methods ranging from internal medicine, surgery to natural remedies can help reduce symptoms and improve the condition. However, the elderly need to carry out treatments under the guidance of a doctor to avoid unwanted side effects and complications. The combination of medical treatment and natural healthcare measures will help the elderly maintain the best sinus health, thereby improving the quality of life. To better understand this disease as well as effective treatment methods, we interviewed Dr. Nguyen Minh Tuan, an ENT specialist with more than 15 years of experience in treating sinus diseases. The doctor will provide useful information about sinusitis, treatment methods, and important advice for the elderly. Interview with Dr. Nguyen Minh Tuan. Question: Can you explain why sinusitis is so common in the elderly? Dr. Nguyen Minh Tuan. Sinusitis is an inflammation that occurs in the sinuses, usually caused by bacteria, viruses, or fungi. In the elderly, sinusitis becomes more common because the immune system weakens with age. As we age, the body's ability to protect and repair damage decreases, especially in vulnerable parts such as the respiratory system, including the sinuses. In addition, factors such as environmental pollution, weather changes, or allergy problems also make the elderly more susceptible to sinusitis. Question: What are the special symptoms of sinusitis in the elderly compared to young people? Dr. Nguyen Minh Tuan. Symptoms of sinusitis in the elderly are often different from those in younger people. The elderly may not have typical symptoms such as runny nose or severe headache, but instead have a feeling of nasal congestion, difficulty breathing, or even prolonged fatigue. In particular, symptoms of sinusitis in the elderly can last longer and easily become chronic if not treated promptly. Some people also have sleep disorders, facial pain, or prolonged cough due to respiratory secretions. Question: can you share effective treatments for the elderly with sinusitis? Dr. Nguyen Minh Tuan. For the elderly, sinusitis treatment must be very careful and appropriate to their general health condition. Treatment methods mainly include the use of antibiotics, if there is a bacterial infection, nasal sprays containing corticosteroids, and pain relievers such as paracetamol. However, the use of medication must be under the direction of a doctor, because the elderly may experience side effects. In addition to medication, natural remedies such as steam inhalation, nasal irrigation with saline, or the use of essential oils such as eucalyptus, lavender, and peppermint also help improve sinusitis. It is important that patients keep their nose clean and avoid factors that aggravate sinusitis such as dust and polluted environments. Question: during treatment, does the doctor have any special recommendations for the elderly to help them recover quickly? Dr. Nguyen Minh Tuan. For the elderly, I recommend that they follow a reasonable diet, increasing foods rich in vitamin C and A such as fresh fruits, green vegetables, seafood and foods that help boost immunity. In addition, patients need to drink plenty of water to thin the mucus in the sinuses, making it easier to drain. Gentle exercise such as walking, yoga or breathing exercises are also good for sinus health, because it helps increase blood circulation and reduce congestion. More importantly, patients need to have regular health checkups to detect and treat health problems related to sinusitis early. Conclude: sinusitis is a common disease in the elderly, greatly affecting their quality of life. Symptoms of sinusitis in the elderly are often unclear, prolonged, and easily lead to chronic sinusitis if not treated promptly. Therefore, prevention and treatment of sinusitis is very important for the elderly to maintain health and independence in life. Treatments for sinusitis in the elderly include medical treatment, natural therapies such as nasal irrigation and steam inhalation, along with a healthy diet and lifestyle. It is important to have close monitoring by a doctor to ensure that the condition does not worsen. In particular, the elderly should be encouraged to maintain the habit of regular checkups, take measures to care for their sinuses, and adjust their lifestyle to minimize the risk of sinusitis recurrence. Health care for the elderly is not simply a treatment but also a long-term care process, helping them maintain good health and improve their quality of life. Ultimately, support and care from family, friends, and doctors are crucial in helping seniors overcome sinusitis. With the right treatment and timely care, seniors can live healthy and enjoy life without being interrupted by sinusitis.